There are two different types of IBS cycle. The first IBS cycle is your own personal cycle that you're going through. And what that consists of is you have your trigger. The trigger could be stress, for example. Stress can be your trigger, and it will throw off your gut, which will cause some type of bowel regulation, some type of pain, bloat, whatever the case may be. You're going through this cycle of discomfort with your IBS. And then eventually you get a hold of it, you're feeling a little bit better, you eat something and it triggers your cycle again, right? So you're going through this cycle of triggering this gut response that's very uncomfortable, that shows up differently for everyone. For some people, it can be extreme constipation. Some people, it could be extreme diarrhea. It could be a mixture. It can be anything in between, or it could just be random and you're just having all types of symptomology. It shows up differently for everyone, but everyone goes through this cycle of you have it, you get a little bit better, and then it's back again. And this cycle leads to just uncertainty and being unsure, because when you're having these flare-ups, it has an impact on your social life. It has an impact on, it could be school, it could be your work life, but it really just throws off the flow of your life overall. And then there's another type of cycle when it comes to IBS, and that is a cycle within the medical system. And with this particular cycle, now you have your trigger, you have your discomfort, you go to your medical provider and they're trying to find out what's going on. Sometimes you get a related diagnosis, sometimes you don't. They may give you meds, you try it, it works a little bit, or it doesn't work. You're back to the doctor, they're doing more tests, they're not finding anything, or they do find something related. They give you another type of med, or they want to do a procedure, or they want to send you to a specialist, and you're in this cycle with the medical industry and nothing fully, truly works. And it can become very exhausting. It becomes exhausting for a lot of people. And what happens is, at some point, you're going in, you're complaining about these problems, they're not finding anything. Sometimes they may find inflammation, but a lot of times they're not finding anything. And then they start to look at you as if this is a mental health issue. So now they're saying that it's something going on with your mental state, and now they're prescribing anxiety medication. They're prescribing medication for depression, and if you're lucky, they may prescribe something to help with overall inflammation in your gut. But for the most part, it turns into a mental health issue. So everyone is on these cycles that they can't get off.